think the upper airway is often the forgotten part of the respiratory system when it comes to respiratory disease. And I really wanted to talk about the correlation that we see in the upper airway with many of the respiratory conditions that have been discussed today. The phenotypes that are described in the lower airway, we really see the exact correlation of that in the upper airway. Using endoscopy is critical. I really think any respiratory physician or any specialist looking after people with respiratory disease need to consider doing endoscopy. It's an easy thing to do, it gives so much information, and it's the addition of endoscopy to the investigations that we offer patients is relatively easy compared to bronchoscopy and the effort that involves in undertaking bronchoscopy examination. When it comes to treatment, there was a lot of discussion today about delivery of topical therapy to the lower airway, particle size, where it ends up. This is incredibly true for the upper airway as well. Topical therapy and how it gets into sinuses and where it actually goes, how you put it into the nose, where it ends up, is just as important as it is for delivery of topical therapies to the lower airway. And finally, being able to have a few clinically important biomarkers to distinguish the phenotypes of disease means that we can offer patients some disease-modifying interventions to change their condition. It's not simply just about suppressive pharmacotherapy delivered topically. And being able to pick out these patients, it may not be everyone, but it's very important. It really provides an avenue beyond just simply topical care to managing patients.